Hello, I'm Dr. Dean Francis. I graduated from the University of Illinois College of Dentistry in 1982. In my 40 plus years of clinical practice, I like to think I picked up a few tips and tricks of how to make dentistry easier, faster, with better outcomes for our patients. And just like you, I've taken a lot of continuing education classes along the way where I hope to pick up one, maybe two little nuggets that I could use. My goal is to give you all those nuggets that I've picked up over the years, all very condensed, that you can use immediately in your practice. I am not compensated by any company for any of the products I show. Everything I show you are things that I use in my practice. The first thing I want to show you are loupes and a light. If you do not already use loupes and an integrated light in your practice, I strongly urge you to look into doing it. You can't fix what you can't see. And with the loupes, you will see things way beyond anything you thought you could see before. If you have the loupes but not the light, I strongly urge you to get the integrated light and battery. Lumadent makes a very affordable battery and light combination. The loupes, any one that you like, try them out, get one you're used to that you like. They take a while to get used to, but once you have it, you'll never practice without it. The light is a huge difference because it follows you, and it's much brighter than any overhead light that you have to worry about contamination on the handle, things like that. So please, seriously think of getting lights and loupe if you don't already have them. The next most important thing to have is an air-only syringe. Now, we all have air and water syringes in our units. The trouble is that when we're drying things off, whether it's bonding agent or the tooth or the inside of a crown, oftentimes there's a little water still left in the nozzle and the O-rings and the springs. So you can get a little water contamination and not even know it. The best thing to do is have an air-only syringe. It's very easy to do. You can just tee into your air line in your unit and hook it up to a regular syringe, air only, or they make single button syringes that you can use as well. But if you want to make sure that your bonding protocol is working well with no water contamination that may get in the way, get an air only syringe. It's the most important thing you need in your practice right now to make sure that you do not contaminate your bonding interfaces. This is Troll Foil, Troll foil. Troll foil is an excellent articulating paper for you. It comes with an integrated holder for it. It is extremely thin. This is the material you need when you're marking occlusion on either Emax or zirconia crowns, which do not mark terribly well with regular articulating paper. And for some reason, if you have a little Vaseline and you coat both sides with a very thin layer of Vaseline, it works even better. Don't ask me why that works, but it works very well. But Troll foil is definitely something you want to use if you are doing really hard substances like Emax or zirconia crowns. Additionally, if you cut off a little strip of this, you can use it like a little shim stock just to double check your occlusion for any interferences or heavy bites. Next thing I'm going to talk about is buffering lidocaine. If you don't already know all the reasons that we want to buffer lidocaine, let me just tell you a couple of them. One, lidocaine comes packaged in a very acidic solution. That acid is to extend the shelf life on lidocaine. Once lidocaine is buffered, it only has a shelf life of maybe 24 hours. So you can't very well sell something with a shelf life of only a day. The reason we want to buffer lidocaine is because it comes in a very acidic solution, which is why it stings when you inject it. By buffering it, you can give painless injections. Patient won't feel because they're not getting acid injected into them. Now, lidocaine only works on the nerves when it's in a neutral pH. So it will go to work much faster than it would when it's acidic and your body has to neutralize it first to work. If you have a hot tooth, they'll never get numb otherwise. The buffered lidocaine will help do that. On anterior teeth, you can give injections between 6 and 11. Patients don't feel it and they get numb immediately. It's a wonderful tool to have in your toolbox. I'm going to show you how to do individual carpules. There are systems out there that will do it for you, but they usually do it en masse, maybe 10, 12 carpules at a time. You don't need that much in a day oftentimes, and so it's a waste of lidocaine. You'll have to throw it out. This is how you do it individually. You're going to start with the carpule of lidocaine. Use your 2% lidocaine. You're going to put a needle on. Usually I use a 27 or 25. It's easier. Use a syringe that does not have a retractable harpoon in it. If you can get a flat one, that's best, or break that off, because you don't want to engage the rubber stopper. What you're going to do, you're going to squeeze out the lidocaine until that stopper meets the little band that's on the carpule right there. Once you've done that, you'll take that carpule out. You're going to use 8.4% sodium bicarbonate injection. And I'll have a thing in here of where you can order this. And this is a 0.5 milliliter insulin syringe. I'll also show you where you can get that. What you're going to do, you're going to draw this down to a 25. What you want to do, you inject that air first so you don't form a vacuum inside your solution. You're going to draw this out to the 25 marker. Boop. You're going to inject that into the end of your carpule. Now, when you put that in, you're going to see that rubber stopper goes back to about where it belongs. It'll be right around in there. You're all set to go. Put this in your sharps container, and this is ready to go. Boom. Like I said, it's only good for a day, so you can't do this weeks ahead of time, but you can do a couple of these a day, especially if you know what patients you have coming in. It is a real time saver, and the patients love the fact that it's much more comfortable. Have you ever given a lower block? Patient says that they're numb, tongue's numb, lips numb. You go to work on number 19 or 30, and they're still feeling it. Very frustrating both for you and for the patient. The problem is oftentimes there are accessory nerves coming into that tooth. You have long buccal, you have recurrent hypoglossal, you have all sorts of extra nerves coming in. The way you want to deal with that is you want to numb them up. Septicaine works extremely well for doing this because it's a smaller size molecule, it will infiltrate better. So after you give your block, I like to take Septicaine, do a quarter carpule long buccal nerve block right on the buccal of the tooth you're working on, 19 or 18, and then do it on the lingual of it. Now you can do it right at the mucogingival line or go down a little lower, inject down there. If you put in Septicaine, both buccal and lingual on that tooth, guaranteed they're not going to be feeling any of the work that you're doing, and they'll be very happy about that.